So I have a question, if there's nobody else coming up, just about the use of cannabis to treat the withdrawal symptoms that occur as patients are coming off opioids. Are you aware of any literature that addresses cannabis use? Because there's the idea that they could be synergistic, but there's also the idea that as somebody is trying to come off, they're having severe withdrawal symptoms, but cannabis could help mitigate those symptoms, and it's happening through that effect. Any comment on that?
Yeah, so I think this is sometimes happening. There are some animal data clearly that have been done that if you take animals that are chronically exposed to opioids and you stop the exposition of opioids, they go into opioid withdrawal, and you can reverse that with some cannabinoid agonists. So I think the evidence is very clear from this opioid-cannabinoid interaction happening at this level as well. There is also lots of anecdotes of patients that are dependent on opioids that get into severe withdrawal, and they try to manage that the way they can, and sometimes they use cannabis to ease the withdrawal. So I think it's certainly there is good evidence that this could happen as well. There is limited data supporting it in humans. I think there is maybe 1 or 2 papers suggesting it's happening, but it's not used as a form of treatment at that point. And there is also a very interesting literature emerging on the use of potentially CBD to reduce drug-seeking behavior. So you can, and that's the work of Yasmin Heard in New York, so you can train animals, let's say, to inject heroin, and then you can put them in model where they will relapse for heroin seeking, and you block that by administering CBD to those animals. So there is this idea that if you use CBD, you can decrease motivation for drugs, and that has been shown for heroin, but also other drugs as well. So that's quite an intriguing area of investigation.